All right, what's up, Dr. Good? And this is my palpation video. This is Christian. Do I consent to palpate?
Yep.
All right, let's do it. So we got the iliac crest. Get on the back here. Up top. And we have the anterior iliac, or anterior superior iliac spine, which you can feel right here at the sides. You have the anterior inferior iliac spine. Sorry, he's a tickly yellow guy. We go back here. We got the sacrum, which you can feel just kind of between the dimples here in the sacral hiatus. We got the greater trochanter, the side of the femur, just up here, and then the lesser trochanter just right below it. Then we got the posterior superior iliac spine, which is right about here. Then we have posterior inferior iliac spine, which is down here. And then we have the ischial tuberosity, which is the sitting bones right in here. Nice. And the pubic symphysis is between the pubic bones right in the middle. All right, moving on to muscles. You got the iliac psoas, which is the combination of the psoas muscle and the iliac muscle just in here, which help with hip flexion and lateral rotation of the femur. Got the rectus femoris coming down here, which helps with knee extension and hip flexion. Got the sartorius, which comes all the way up in here, goes down to here. And this helps with hip flexion, a little bit of abduction, also some lateral rotation, and a little bit of knee flexion. And we got the pectineus, which is in here, and the more superior, like kind of abductor muscles here with hip flexion and adduction. You got the adductor brevis right here, hip adduction and slight flexion. We got the adductor longus, which is down here a little bit more, hip adduction and slight flexion, and also the adductor magnus, which is kind of this whole area of the femur here, and it does hip adduction and extension. All right. Now the gracillus coming back here, going down here. Gracillus will do a little bit of hip adduction and then knee flexion. The semitendinosus here, the hip extension, knee flexion, and medial rotation. The semimembranosus, which is here, doing hip extension, knee flexion, and medial rotation. Then we got the biceps femoris, and down here doing hip extension, knee flexion, and lateral rotation. We have the glute maximus here, which does hip extension, lateral flexion. The glute medius, more superior up here, does hip abduction and pelvic, just more of the pelvic stabilization. The glute medius, which is deep to both muscles, just in here, and this does hip abduction and also pelvic stabilization. You got the tensor fasciae lata, which is up here, kind of more on the superior aspect of the hip here, just right here. This is going to do hip flexion, abduction, internal rotation, and also tenses the IT band, which moves me to my next one, which is the iliotibial tract here, or iliotibial band, which goes down here, which stabilizes the hip and knee, but also transmits tension down the TFL here. Now